right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey, physical therapist and physician advocate, and she brings together two physicians, Nicole Solomos, a sports medicine physician, and Alae Kawam, a surgical pathologist. Together, they all wrote the Kevin MD article, True Stories of Doctors, Reclaiming Their Humanity in a System That Challenges It. Everybody, welcome to the show.
Thanks, Kevin.
Thanks for having me.
Thank you.
All right.
Thanks for
So,
having us.
Kim, you always bring together such a diverse and wonderful group of clinicians that we can discuss in this podcast. So, what brought Nicole and Alae together?
Sure. So, Nicole, I would say that we communicated, I'd say indirectly related to you, Kevin. And that was because my first article and podcast, as you know, were a tribute to my radiologist. And when I shared that on LinkedIn, Nicole commented that he was her doctor too. And I couldn't believe that. And nobody in my life knew him. And I did everything during the pandemic. So nobody could go with me to my appointments or my surgeries. And it was a disenfranchised grief, when I found out that he died. So to know someone else who actually knew him. And around that time, I was starting the YouTube channel, and people told me I should have an introductory episode, but I didn't want to just talk to the camera. So I asked Nicole, because she didn't really know my story, if she'd be willing to listen to my story and to do this introductory episode. And she graciously agreed. And then I interviewed her. And then Alae, the day I published my first episode, it was with Dr. Todd Otten.
Yep.
And Alae reached out to me and she said, "Can I be on your YouTube channel?" And I said, "Sure." So we had never communicated, until we were on the video together. And she was such a delight, as you'll see. So then when they both graciously agreed to write chapters in the book, and then when I reached out to you, so thanks again. So if people haven't seen it, this is the book. And when I reached out to you, and thank you so much for writing the endorsement. And I even said to you, I think you know most of these doctors. And then when I explored it further, I'm like, well, I think there's actually only two that hadn't been on independently or with me. So I thought that you and your audience would just love to meet them. And here we are.
All right. So, wonderful. So, let's start with you. You're a surgical pathologist. Tell me the story that you'd like to share with my audience here today.
Yeah, I think so. I think a lot of learning that I've done over the past is kind of what I want to bring to the audience, which is like physicians struggle with burnout. Physicians are human too. And I think part of what the cure is reconnecting with people, right? I think part of it is acknowledging issues. And something that I really want to highlight is like bringing that good leadership type, I guess, research that's been done, what good leadership looks like, into the medical field and taking ownership and responsibility for that. So what, in context of the article, obviously a lot of it was bred out of like frustration and seeing my clinical colleagues being burnt out. Obviously, one thing that the pathology field struggles with is severe understaffing, which can become a patient care issue when you have so many cases and not enough pathologists to spend enough time on each case. So I would say like there was this, frustration with certain things. Obviously, staffing was one, but it really, gave us a little bit of data or information on, well, what's leadership doing about this? And is this truly a pathologist issue, or is this like, let's zoom out for a second and really look like, okay, well, what other issues are going on? So I really like to shed light on that and how we can address those things. Obviously, I think a lot of doctors are frustrated with medicine. And I think that part of what I want to bring out is, well, you're not alone. And there is a movement and there are people who are doing things about it. And obviously Kim, has taken the initiative to really bring people together and help create that movement.
So, tell us what you're seeing, because when people think about pathology, sometimes patient connection isn't as high on the list as fields where typically you're in the exam room or in the hospital. So tell me what you're seeing in terms of the burnout you're seeing among your fellow pathologists and how reconnection within that field you think can help that.
For sure. I think a lot of systemic decisions on the large scale, which is like how many pathologists are we bringing into each organization? What bureaucratic tasks or administrative tasks are we putting onto these? And, the research shows that too many administrative tasks, understaffing, that kind of creates a vicious cycle of overwork. And when you're overworked and you're spending, till 8 p.m. every day looking at cancer case after cancer case after cancer case, because rightfully so, we are disconnected from the patient to a certain extent. And you kind of have to be a little disconnected. Otherwise, you don't want it to cloud your judgment. So you kind of do have to look at, the glass slides as a specimen. But it's very important to remind yourself, like, this is a person and there is going to be a clinical decision made based on what I say on this, final diagnosis or on this report. So we might be disconnected from the patient, but we always come back and remind ourselves, like, we are physicians. It's easy to forget that when you're just overburdened, and it becomes very hard when you have to keep up with a certain amount of like income because you got to pay your bills, right? But
Yeah.
the slides don't cut themselves, the tissue doesn't cut itself. So really what it comes down to is leadership, not just approaching the patient with compassion, but approaching the physicians with compassion too, and what they can tolerate. I think a really big solution, or a very important way of looking at this, is to understand that physicians need some level of autonomy, some level of personal growth and connection, whether it's with other clinicians, whether it's with their family. I think just reconnecting with people is going to help, in addition to the systemic changes that need to happen, mitigate the burnout crisis.
Nicole, you're a sports medicine physician. Tell us a story that you'd like to share with us today.
Well, I think that when you ask about the article and what brought me to this space and things is that I think more than one thing can be true. And that's always been kind of the theme for me is that, yeah, I went into medicine, but I also identify as an athlete. I also have other interests, and I was never one of those people one of those physicians, I should say, who really thought that my job was my only identity.
Mm-hmm.
And my story in the book is that I I really felt when I was a patient, when I was seeing another doctor, I really felt slighted, and I identified with I really truly identified with being a patient and feeling that, almost mistreatment and the aloofness of my physician that was treating me. And so I really feel like I'm very grounded in being just a normal person. And,
Mm-hmm.
I don't just identify with the physician thing. And sometimes I even find myself like, pushing back, on it. So I think that, and another thing that I want to bring forth is that I think it can, more than one thing can be true. And that includes that, I can really have a lot of feelings about physicians, and we all do these days, I think, especially the people in this space, that the system is broken, all those, talk about insurance companies and private equity and hospital systems. And I can also love my job. And my most recent job has shown me that. And I have come to love seeing back pain and neck pain that I never thought those words would come out of my mouth. And I look forward to it, and I am very fulfilled by it. But I can have a day where I'm like, I'm frustrated and feeling the negativity. So my my theme is that more than one thing can be true, and we can embrace all of those things.
So, one of the things that I always mention on this podcast, and Kim has heard me say this before, is that always physicians are more than their degrees. And one of the things that we like to highlight, of course, is that exactly what you said, Nicole, that we are just more than physicians. We could be several things at once. So, Nicole, when you said that sometimes you had to push back against that single physician identity, that you are defined more than just being a physician, what do you mean by pushing back? Did you feel pressure to solely identify yourself as a physician?
Oh,
Give us
yeah.
a story or an example where you felt that you had to push back against those traditional norms.
Yeah, I mean, I was in a practice for a long time where I wasn't an actual partner. I was called an associate partner, but they had kind of like a code of conduct or, unwritten rules. And I just think I heard several of, and to be honest, they were all men, but, I heard one or two of them say that, their first priority over their family, over everything was their being a physician,
Hmm.
and their job. And I even had a relationship with someone early, when I was in medical school, where they said that was going to be their priority. That was their first. And it wasn't, it may have been tied at one point, but I would say it was never I was never going to be that person.
Hmm.
I knew it, and I knew it then, and I still know it, that if I had to walk away, or if I made the decision to walk away, that I have so many other things, so many other things. And yeah, so, and I also, I play soccer. Well, I did until March. I tore my ACL again, the other one. And I still get comments, some doctors that I talk to are like, you have to fix it. You have to play, because I'm 51 and one could argue, and it's a strong argument that I've played enough soccer in my life, but I love it. It's my passion. And I might play again. I might get my knee fixed when I have time. But so that's another example of it where like, some doctors will look at me and be like, what? Literally, just 2 weeks ago, one of the physicians I was working with was like, why are you still playing soccer? What are you doing playing soccer? And I'm like, it's my passion, without thinking. I just that was my answer. So that, that's an example. That's a few examples of what I mean.
So, Kim, when you hear these stories from both Alae and Nicole, Alae talking about burnout among pathologists and the need for leadership to recognize that moving forward, and the multiple passions that a physician can have, as Nicole articulated in her story, what struck you most about hearing their stories for the first time, Kim?
Well, I loved that Alae, her chapter, I believe, in our book and on the YouTube channel episode was like the people's pathologist, and that she was a human. She shared that I'm a human too. I'm a doctor, and even though she talked about in some ways dissociating from patients, in other ways knowing that they're human, that they are patients, and it's just that connection. And Nicole had shared stories, she had been in a practice for a long time and then things happened to that practice and just that she had to leave and then got another job and things weren't well there, but she pivoted again. And Alae, I think you had recently switched
I
did you?
did.
Yeah. So I love that, and it makes me happy and proud. Well, I mean, I say proud. I almost feel like a proud mom to like all my doctor friends, and I'm like, go you! Like realizing like that you don't have to put up with so much shit or whatever you want to say, and that you always have choices, and that there's always a path forward.
I'll let you talk about leadership and the need for leadership to recognize some of the issues that directly contribute to burnout among clinicians. So tell us what you would like to see among leadership to fix some of these systemic causes.
Oh, this is like something I'm so passionate about. You have no idea. I've become obsessed with leadership and I've been, doing a lot of the reading and based on, what good leadership looks like. And there's so many different theories out there. But I think that there's one common theme, and that is compassion
Hmm.
and caretaking for the people that work for you. When you look at your physicians, like they are a extremely important part to the function of the healthcare system. You will take care of them as if they're your own children.
Hmm.
And there's research out there that shows that when you nurture people who work for you and they feel belonging and they feel like they're contributing and they feel like they're having an effect and their voices are heard and they have some level of independence or autonomy, people perform better. And it really takes a step away from the performative ways that leadership is trying to mitigate burnout. The thing is, in today's world where you have extremely large healthcare systems, how do you maintain that compassion on a very personal level?
Hmm.
The wellness things that they try to do, whether it's a lunch or a yoga or whatever, that's great. That's great. But that doesn't solve the root issue, which, part of burnout, I wrote an article about burnout and, feeling ineffective, feeling like you're not accomplishing anything, emotional exhaustion. These are all different factors of burnout. And then people everything else is kind of like a symptom, right? So I want to tell leadership, like, stop looking at us as, billing machines and look at us as people. And I think when you really bring the person into the healthcare system, that you will, have better performance. People will be more engaged. I know disengagement is a huge issue in a lot of workforces, but particularly with medicine and the burnout crisis. But start looking at people as, the doctors as people and nurturing them and listening to them. Everyone's needs are different. The burnout is not like a box, burnout things that we do to change are not boxes to check. These are things that we need to take more seriously in terms of like action systemically. I think a very big piece that's, under that doesn't get enough attention is making the workplace conducive, not just by the people. You can't change the people's personalities, But if your EMR system is terrible, and I have to fight with the EMR system and I have to fight with the computer every day, little changes like this can actually make a huge difference in the workforce, making the administrative tasks that are meaningless, which aren't totally meaningless, but burdensome, one can say, making those streamlined using AI, basically getting rid of the tasks that don't give us fulfillment, I think is one way to look at it. And there's tools out there, AI is a great tool, remote options for certain things to be able to, answering your, emails or whatever it is, like things that can happen remote that can be remote, to give people flexibility. Just look at the person with a person with needs, not, a cog in a wheel to bill. Approach it with compassion, approach it with love. And I think that when leadership takes ownership and responsibility for the people as individuals, then I think that their return on investment, or whatever you want to call it, they'll see better results because that's what they want to see. I know intentionality is important too. It would be nice for everyone to look at this. I want to take care of my doctors because I really care about them. That's a very idealistic. And I understand that, may never happen, but at least approaching it with some compassion and some humanity, I think would make a huge difference.
Nicole, you talk about physicians pursuing passion, sometimes outside of medicine, and how important that is. And I completely agree with you. Now, you talk about when you were in a prior practice, some of the unspoken rules that perhaps pressured you to only pursue medicine as a passion. Tell us the advice that you could give to the physicians listening to you, how they can pursue passion sometimes outside of medicine and push back against that traditional mindset.
I mean, yeah, I think I make time for it, right? I prioritize it so much that I go to bed at a certain time, I wake up at a certain time to get things done. I mean, soccer was a little different. I did it on the weekend. I had a traditional job where I could do that. Most of the time I was able to do that. So I could play on the weekend and call it a day. But for me, we all have the same 24 hours in a day, and having a routine, that's been key for me. And I've always had that. I was an athlete, and I think I got into that. So I think having a routine is really key to pursuing your passions and making it a part of your life, and prioritizing it, and building your world around it.
Absolutely. I think scheduling it, I think that is one way that I've heard other physicians say it in, because sometimes if these passions outside of medicine don't get scheduled, right, it doesn't get done, right?
Right.
So today we're talking to Kim Downey, Alae Kawam, and Nicole Solomos. Their Kevin MD article is True Stories of Doctors Reclaiming Their Humanity in a System That Challenges It. Now, I'm going to end with asking each of you just to share some take-home messages to the Kevin MD audience. I'm going to start with you, Alae.
For the Kevin MD audience, don't be afraid to connect with people. Don't be afraid to connect with yourself, and don't be afraid to connect with your passions, other clinicians, and just don't be afraid to reach out and reconnect what feels disconnected.
Nicole, your take-home messages.
So I think I spoiled it already, but my take-home message is that you can feel burnt out, frustrated, not like the system, and you can also still find joy in your work, still find joy in your private life. So all of those things can be true.
And Kim, as always, we'll end with you. Your take-home messages.
Sure. So Alette had spoken both to like connection and caring, for the caregivers, and just prioritizing those connections. And so Nicole and I made a point. We got to meet in person for coffee once, and then I wanted to introduce her to another physician, Dr. Beatrice Olson, and then we got together recently, and we'll be doing a book signing together next month. And actually tomorrow I'll be meeting Alette in person for the first time because we're doing the very first book signing. So I wanted to give a shout out. Dr. Emmy Vitastasio is a health psychologist in Greece, and she was our editor, and she wrote the afterword. And she said, there are more voices to hear, more stories to share, and more ripples of change to create. So, dear reader, where do we go next? We keep telling the truth. We keep pushing. We keep standing up for doctors, for the future of care, for a system that doesn't just save lives, but protects the people doing the saving. And that's what I'm all about.
Well, thank you all for joining us today and sharing your stories and insight.
Thank you so much for
Thanks,
having me.
Kevin.
Thank you. Thank you so much.